Welcome back into the Talmud, and this is our course entitled The Doctrine of Death. The Doctrine of Death. And we want to talk about death, disease, and the gospel, and specifically within the broader picture of the doctrine of death. And this is our course PS-100, Pastoral Studies. And the reason we want to address this particular subject is there's going to be a lot of information in here over the next few weeks as we continue to study this course together. What is one of the main things that we as pastors all over the world have to deal with? We have to deal with death. What is the central core of Christianity? It's the death of Jesus Christ. What is the central issue toward man? It's the death of man, because the Bible tells us in the book of Romans in chapter 3 verse 23, for all have come short of the glory of God, right? And he says in Romans 6:23, it tells us that he says that the penalty of death, the penalty of sin is death. The wages of sin is death. So we wanted to address this issue, because now as we face all over the world right now in 184 countries this worldwide pandemic called the coronavirus, this is an issue that we have to deal with. How will we, the church, respond to all of these issues? So I want to talk to you about this, and I also want to draw your attention to a number of issues. Now, I want to talk to you about the facts about death. Death, dying, demystified. We want to demystify death and dying. Now, as I undertake this particular subject of the doctrine of death, I am cognizant that I am not a medical doctor, and I want you to clearly understand that. Nevertheless, I have had a great deal of exposure to the medical schools at both at the University of Iowa and the University of Southern California in the United States. Now, in the late 1970s and in the early 1980s, I served as a student recruiter for and eventually became the assistant dean of admissions and financial aid in charge of medical students being admitted to medical school. Now, in both roles, I had to interact with numerous doctors and professors at both medical schools. And one of the main issues that I was asked to address was why were so many medical students dropping out of school? Why so many had dropped out of school? So I want to use this as a backdrop, as a foundational point as to how we will approach in this particular class. Now, we conducted a survey of 862 students over a 2-year period that had previously dropped out of school over the previous 6 years. And what we discovered was that many of the students entered school with a very high ideal of saving lives. Once the students were exposed to the death of patients, many of their dreams were shattered and made the decision that medical school was not the path that they thought it was going to be for them. Then the decision was made to create an orientation program that would expose the students early in their training to the concept of death and to the reality of death. And we had to create a program that exposed the students to both the legal and the medical issues of death. Now, I had to work very closely with the School of Law and with the School of Medicine with the School of Medicine to design an orientation program. And now one of the components was to expose the students to death by having an 8-day orientation program with the campus morgue. And I was in charge of creating that particular program and executing it. And I did so with a lot of help from the law school and from medical school and their personnel and their staff. Now, at this particular program, the students were exposed to various autopsies and visiting with terminally ill patients on rounds. They were making rounds with the attending physician. Now, it was in this context that the students also had an orientation program that involved the legal and the medical ethics as related to death. Now, I was personally involved in creating all of the aspects of the program and spent many hours in both practicum and lectures on these particular subjects. Consequently, I had to learn the legal and the medical language to communicate intelligently with the professors at both schools of law and medicine. Now, once again, I am not a medical doctor, and I am a pastor, I am a professor, and I am a theologian. Now, in the mid-1980s, I was also involved with 3 refugee camps during the civil wars in the countries of Guatemala, El Salvador, and Nicaragua. And I was the director of these refugee camps, and I oversaw the burials of thousands of refugees during my time there. And with very little medical supplies and no medical staff, many decisions needed to be made as to who could be treated and made comfortable until the end of life. Every day at 4 in the morning, we would conduct mass burials. Then in the 1990s, I was involved with death and burial of more than 20,000 people in Africa during the AIDS crisis. Once again, I found myself with dealing with thousands of people and grieving families who had absolutely no answers to the question of death. It is from this background in the secular arena, as well as a pastor for over 36 years, that I approach this particular subject. In all three of these arenas, decisions had to be made regarding who would live and who would die. When I entered seminary and finished my theological education, one thing was extremely clear to me, that the doctrine of death was treated very lightly. My educational background consists of a bachelor's degree, a master's degree in counseling and education, a master's in divinity, and I have 3 doctoral degrees in ministry and theology. And yet, as a pastor, I found myself lacking the profound understanding of death from a biblical perspective. This is exactly where I find that most pastors that I dealt with, worldwide, lack a true biblical understanding of the doctrine of death. Now, currently, we have over 12,000 pastors involved in our training program, and they have revealed a great need of training in this particular area, in the doctrine of death. Now, the overwhelming majority of our pastors, they live and they work in the third world countries, where death is a daily reality. But the question that I posed, to all of our pastors, have you taught the living the doctrine of death? And the answer has been overwhelmingly no. Now, how you and I treat this subject openly in the life of the church will determine the level of faith in the sovereignty of God. Every human on earth will face death eventually. How we face it will determine the great testimony of the church to a dying world that is in a great need of a Savior. So I'm going to begin to address this issue at first. I want to talk about the facts about death and what has happened to us. And I want to use some contrast, and I want to begin to look at it from a number of different perspectives that are crucial and important for us to understand this particular subject. Now, there's a remarkable difference between how an unbeliever and a believer look at dying, look at death, and look at the afterlife. Now, for the unbeliever or the agnostic, death is mysterious and the afterlife is even more dubious, to say the least. Now, for the believer, death is not an extinction or a terminus, but only a transition, a junction at this point between moving from one phase of life to another phase of life. Though solemn, it is demystified in Christ, and the afterlife is the best life that we have. So let's consider this particular contrast. And as we go through this course, we're going to be dealing with lots and lots of scripture. But in this first section, I will not do that because I need to establish some kind of a foundation from a secular perspective, because that's where most of us live in. Now, I want to talk to you first about after death. I want to talk to you about agnosticism, agnosticism's version. Now, what's an agnostic? An agnostic is a person who simply tells you, I don't know. I don't know if God exists or he doesn't. I don't know if there's an afterlife or not. So it's from that perspective, because we're witnessing that right now in this worldwide pandemic called the coronavirus or COVID-19. So allow me to share a true story that I read about in the American Medical Chaplain Association. Okay, that will kind of highlight the main point that I want to make about death in this particular section of our teaching. Now, in this story, let me quote it for you, and I read it for you, and let me read it for you, because I think that you need to understand the subtlety and the nuances of what's taking place here as we see literally thousands around the world die due to coronavirus. Sally was the name of a nurse. And Sally was a hospice nurse, okay? And she stood by a gentleman's name by the name of Bruno. Bruno's bedside. Now, Bruno was a prisoner. He was a prisoner with what they call ALS disease, okay? It's the amyotrophic lateral sclerosis disease. It's ALS, okay? And he had been transferred to the hospital with his fifth bout or fifth attack of pneumonia in the past 6 months. Now, why is that important? Well, because this man was serving a life sentence for the murder of an elderly neighbor, okay, who had attempted to stop him from stealing all of his narcotic pain medications because he was a drug addict. Okay? And so while he was stealing that, he killed the man. And now he was incarcerated for this, obviously, and he developed ALS disease. Okay? And he underwent a trichotomy, okay? And went through a trichotomy, okay, and became dependent upon what's called a ventilator to breathe. And we all know about ventilators now because the world is talking about the thousands and thousands and untold numbers of ventilators that the medical profession says that they need. Now Bruno had a choice, okay? And here's where you have to understand the subtleties of this, because what we're attempting to do here is to demystify dying and death, and we're doing it right now through the agnostic's version of how he sees the world, how he sees death, and how he sees the afterlife. Now, Bruno had a choice. He could return to prison on the ventilator until suffering the next attack or the next bout of pneumonia with the possibility of dying by suffocation. Or he can have the ventilator withdrawn, receiving medications to manage his respiratory distress, okay, and dying in the luxury of a hospice facility instead of in the prison. Needless to say, Bruno, who thought he was a victim of injustice, did not like his choices. So either way, he didn't like what was being presented to him. But one of the things about the story tells us this. As he lay silent, okay, with expressive eyes, okay, paralyzed, his right wrist was handcuffed to the bed rail, and a prison guard was by his side. Now, Sally, the hospice nurse, presented her case for the hospice care. And I've dealt with a lot of hospice people. Bruno, he says, and the hospice nurse said this, Bruno, I know that this is a difficult choice to make, but we will keep you comfortable after the ventilator is removed. You won't have to go back to prison, and you won't have to suffer anymore. Sally was presenting what? She was presenting a common view that what happens after death is in some way better than persisting in this present state of suffering. Even for the unrepentant murderer who sees themselves as victims of the system. Okay? And this story has a lot to say to us here. And we're going to draw it out for you as we go over in these next few minutes. Look, if you think about it, in Europe and America, it is quite acceptable to choose or to create some self-customized, okay, hereafter. Think about it. We seem to think that we have that kind of a luxury, okay? And if one wants to believe in nirvana, okay, one wants to believe in reincarnation, one wants to believe in a happy hunting ground, okay, one wants to believe in heaven, or any combination of these possibilities, or else simple annihilation, okay, the modernists will not object, right? Provided the belief is not imposed on others. So what we have is a situation, you can believe whatever you want, okay, regarding death, dying, and the afterlife. Now, according to the modern mindset or the postmodern mindset that we're facing with today, no one really knows what happens after death. What is emphatically clear is that everyone is dying, and one day we will all die. That's clear. At least, at least that's what the modernist says. Okay, so why not permit the imagination to wonder when it comes to the afterlife and the hereafter? Why not? It's not going to hurt anybody. That's the kind of thinking and language that we hear today. Now, for many centuries, the church was the predominant institution addressing dying, death, and what happens after death. Not hospices, not the hospitals, not the medical institutions that could be indifferent to or at odds even at odds with the traditional Christianity. Following the beginning of the scientific age in the 17th century, because this is not something new that just happened yesterday, but following the beginning of the scientific age, which is at the 17th century, okay, the medicalization of death in the 19th century, and the increasing effectiveness of medical science in the decades that follow, the church was completely pushed aside. And we see that today in this worldwide pandemic of coronavirus. It's the medical doctors and the scientists, okay, who are counseling us on death. The church and the pastor has been set aside completely. A paradigm shift occurred. Okay? The church is now on the periphery, and modern medicine has shifted to the center on how to deal with death, dying, and the hereafter. Moving into the 20th century, many hospitals in the West, okay, once Christian institutions in purpose, once Christian institutions in ethics, once Christian institutions in practice, have now become Christian in name only. Influenced by the rise of higher criticism, influenced by the rise of liberal theology, and influenced by the rise of the social gospel, these hospitals no longer affirm a supernatural, natural, Christ-centered worldview grounded in Holy Scriptures. That's over with. That's gone now. Now we come into the 21st century. Modern medicine is eager to fill the void left by the traditional church, left by the confessional church, left by the biblical church. We are now seeing this played out and manifested in the worldwide pandemic known as the coronavirus. We're seeing this clearly today. Now, since two absolutes of dying and death have become medicalized, okay, that is, aspects of the human experience to be addressed by doctors and nurses rather than by ministers of the word or one's fellow Christians, it's not surprising to see that healthcare professionals, healthcare workers like Sally, that we mentioned in this story, right, is asserting an unqualified view of what happens after death to provide answers and to provide hope and to provide comfort and to provide hope. This position is commonly referred to as agnosticism, okay? Agnosticism, which is derived from the Greek word agnosis, okay? And its meaning is a state of unknowing, a state of unknowing. That is, with respect to the metaphysical questions such as the existence of God or an afterlife. Now, an agnostic, okay, claims not to know the matters beyond his or her ability to observe or to quantify them. This approach to the empirical or to the scientific effects has the appearance of humility. Right? But as a philosophical system, however, agnosticism is proud and has an unconditional assertion, okay, in which all that can be known with certainty must be measured, it must be tested, it must be demonstrated and verified by hands-on experience. So faith has no place here. Agnosticism is an outright rejection of non-empirical truth, which claims without empirical validation, the impossibility of knowing truth outside of the process of scientific investigation. So faith, the church, the Word of God, the minister has no place any longer in the discussion of dying, death, and the hereafter. Now, if you look at the Western democracies, okay, I want you to understand that two major issues stand behind agnosticism and the contemporary Western world that we live in. Pluralism is one, and the eventual failure of medical science to sustain life. And we both are true today. We have everything is pluralistic today. Everything is pluralism, and science and medical science has proven over and over again its failure to sustain life. In Western democracies, citizens have the right to believe what they choose. Is that not true? So long as they do not act on their beliefs in violation of civil law, and they tolerate other people's beliefs. And that's okay, except that Christianity and faith is one of the issues that everybody has license to not tolerate. And all of these personal views address the hereafter in some kind of way. So agnosticism provides a vehicle for quote-unquote tolerance and quote-unquote affirmation. Now, another primary factor already alluded to is the innate human need for answers, the innate human need for comfort, and the innate human need for hope. Dying and death are absolute. We are dying, and one day we will all cease to be as we are now. That's a fact, and that's a reality, okay? Now, this is mysterious, this is uncomfortable, and even dreadful for many agnostics. Someday medical science will fail us, and it has, when the doctor says he can do no more for us. I cannot tell you how many times I've stood next to a doctor and a dying patient, and those words passed his or her lips. And at that point, the patient stopped looking at the doctor and turned to me. Now what? After all, the optimistic counsel from all the well-meaning healthcare professionals and the hopeful state-of-the-art medical treatments, okay? Dying and death stand firm and fixed on our human agendas. So then the question is, then what? In modern medical practice, a referral to a hospice is made, and the end-of-life experts, they come alongside to support the individualized answers and provide comfort in the midst of suffering and affirm one's self-customized hopes for good or life after death. And how do they do that? They do it how? By providing a whole lot of medications and painkillers. This is what they do. So I want you to understand, this is what you and I as a pastor have to face in the Western modern world today. And we're seeing that influence just literally go all over the world. It goes all over the world. And when it does, okay, it consumes absolutely everything in its sight. And everywhere we go now, we're seeing that faith, the church, and the preacher has been set aside completely. So now, we look briefly at this idea of after death in the agnostic version or agnosticism's version. Now we'll look at the second area with you in these remaining few minutes that we have, and that is death as a natural part of life. Death as a natural part of life. And I want you to understand that with me today, because it's really crucial that you and I understand this. Look, we're watching right now, and every time a major decision is made around the world, precedents get set for the next level, the next stage, for the next decisions that are going to be made. And we're seeing this played out right now. Medicine is failing. Science is failing. Now, medicine and science do make progress and do make great, great advances. But the one area that we do know of that it fails consistently, okay, by design, because it cannot prevent death. Death is not just, okay? It's not just some metaphysical experience. A number of years ago, and this is many, many years ago, this is going back into the late 1970s and the early 1980s, when I was involved at the medical schools and the law schools at the University of Iowa, as well as at the University of Southern California. And one of the questions that came up in our committee meeting, because I had to deal with a lot of doctors at that time. I was one of two non-doctors who served on this committee. And at one of our training programs, our orientation program that I spoke to you about earlier, and the students had to come and look at all these dead bodies, these cadavers in the morgue. And one of the issues that came up was, okay, what exactly sustains life? And I asked, why does the human body live and why does the human body die? And I got all kinds of physiological answers to this. And I was explaining about the blood cycle, and I was explaining about this and that and so forth, and how oxygen moves through the body and everything. And so I asked the question, I said, look, you explain to me how and not the why, and I'm asking you the why. And in that question, after they attempted to answer me multiple times, I said, that's not my question. Why does a person live and why does a person die? And they finally, one doctor looked at me, he got frustrated, he says, my answer is not sufficient for you. I said, no. We were at the morgue earlier that day, and a body was laying on the slab, and all of a sudden the body sat up. This person passed away, was dead. And I said, explain to me, how is that possible? And they explained, well, a lot of times the oxygen shifts and it moves in the body, and a hand will go up, a hand will move, a finger will go up, a leg will go up, okay? And sometimes the whole torso will lift up, okay? So I said, well, if that is true, and I trust that it is, the dead body had oxygen, but why is it dead if you're telling me that the body could no longer function without oxygen, yet this body had oxygen? And the doctor got a little frustrated with me about this. Well, here's the truth. In all the medicalization of death, dying, and the hereafter, okay, the issue of the spirit of man is never dealt with. It's just simply not dealt with. And this is where we're going to eventually get to this issue about death and dying, demystify. And that's what we want to address in this course, in the doctrine of death. This will be an extensive course because you and I as a pastor, we have to deal with people on a regular basis, where they are passing away and their loved ones are passing away, and what happens in the here and now will impact the then and there, the here and after. So this is what we want to begin to look at in this particular course, PS-100, in the doctrine of death.